Assalamu alaikum, the communication day. Starting with Mr. John, 65 years, was admitted for investigation of a pleural effusion. He firstly saw his family doctor about 3 months ago with a dry cough and breathlessness, anorexia, and weight loss 4 kilograms. He had to wait for 8 weeks before being seen in an outpatient clinic, which caused distress for both the patient and wife. The chest X-ray showed a moderately sized right pleural effusion, and he was admitted for further investigation. Pleural aspirate has shown blood-stained pleural fluid, which is biochemically an exudate and, on a cytology base, contain malignant cells suggestive of an adenocarcinoma. A pleural biopsy confirmed infiltration by an adenocarcinoma, possibly gastrointestinal tract rather than lung origin. The patient's wife said he shouldn't be told. The patient, however, has asked you to be entirely honest with him when the result of the biopsy are received and has given his verbal consent for you to speak to his wife. Your task is to explain the result of the test to the patient wife, Mr. John, and the implication of the diagnosis if you think this is appropriate. Okay. Now I will share the timer. Then you can start practice right away. Okay. Here you go, Dr. Mohammed.
Hello, good morning.
Hello,
Yes, good morning.
good morning.
So my name is Ahmed, one of the medical SHO. Can I confirm that you are Mrs. John,
Yes, doctor.
wife of Mr. John?
Yes.
Okay. Could you tell me how much you know about Mr. John condition?
Okay, doctor. I was worried about my husband because he has lost his appetite and he lost weight and he become breathless. And then we went to the family doctor and about 3 months ago, and it took about 8 weeks to be seen in the outpatient clinic. And then they done some tests and also scanning for him, and I am now here for to know what is the result.
Okay. Thank you for attendance. The result is back, and I'm afraid to say that Mr. John uh, has some overgrowth in his gut. As the result came that some cancer cells in the fluid around the lung. So it could be cancer or malignancy or just cancer coming from the gut. Um,
What are you talking about, doctor? Is he have a cancer?
I'm sorry to tell you, the result is a yes. He has a cancer called adenocarcinoma, which is coming from the gut, and it invades the covering layer around the lung and causing this fluid around the lung. And actually, the SNAP test confirmed that this is cancer.
Oh, doctor, how this happened? Why?
I'm really sorry. I'm really sorry to tell you that cancer can happen for anyone. He was presented with signs suggestive of this, like breathlessness and dry cough and weight loss. Um, hello.
Um, yes. Could
Mhm.
this could this have a cancer because of the delay of diagnosis? Because of this, all these months he didn't diagnose?
Uh, I cannot say this delay because the symptoms is dry cough and the breathlessness. He was seen in his GP and he referred to outpatient clinic. It took 2 months. Um, I cannot say this is delay. This is the usual process of referral. So I
So
cannot.
who is responsible for this?
Actually, there is no error for this. There is no medical error for this. So your husband was presented with dry cough and breathing difficulty and some weight loss, and he was seen by the GP. And because we have big waiting list in hospital referrals, so this is the list interval time he may wait. So 8 weeks is not a big duration, because actually we have a big long list.
Okay, what are you going to do?
Is Mr. John coming today?
Yes, he is in hospital.
Okay, I will have a meeting with him. Um, I may explain to him the result of the SNAP test. And
No,
I would,
doctor, no, please, don't tell him. Don't tell him. I think this will not be good for him.
I appreciate your worries. However, he is the one who decide. Because he's awake and he has a chat with us, so he has the right to know actually what's going on about his medical health. So despite I'm appreciating your worries, but actually he's right to know his medical problem.
He cannot bear this. I think he will be in very horrible situation.
I appreciate that, but we will offer some social support for him. We'll introduce this news very gradually. Um, will be will give an enough emotional and social support for him. How
Okay,
does it
so
sound to you?
about okay, so about his condition, his health condition, what we are going to do? Any treatment?
So first, we will refer him to the multidisciplinary approach, which is gut doctor and lung doctor and cancer doctor. And after meeting, they will decide the next step of management. How does it
So
sound to you?
there is a cure for his case?
Um, the multidisciplinary team will decide if there is any probable surgical or chemo or radiotherapy treatment options for him. So there is an cancer doctors and lung doctor and that doctors, they will decide, sit together, and they will decide the best treatment option for him. Uh,
Okay,
could I ask you a few questions?
okay.
Um, is Mr. John has any living wishes?
What are you talking about? Is he gonna die?
No, I'm just exploring what's going on, because it is he has cancer, and this could be could significantly reduce his life expectancy.
Okay, I don't know. I think no.
Anyway, I will have a chat with him and exploring with him his language, his life wishes, and if he has any documented advanced directive. Is there anyone dependent on Mr. John?
Yes, me.
Okay, good. Is he smoker?
Yes.
Okay. Is someone advised him to stop smoking recently?
Does this matter now?
Yeah. If the treatment option not yet decided, it will be decided within a few weeks. So he should stop smoking. We may refer him to smoking cessation clinic to stop it, to help him to stop it.
Okay.
Okay. Do you have any
Oh,
other questions?
no, no, doctor. I have no other question.
Thank you.
2 minutes.
No other concerns. But
No other concern.
Yeah, but you have to do
You can
something
summarize.
else.
You can
Uh,
summarize.
or something else you want to explain or you want to add. You can
this is the
address. Uh-huh.
dialogue. So the task is just address her concern. If she doesn't have any concern, so we'll move on.
Okay, but there's sometimes hidden points and hidden agenda in such scenarios. What you have to do, you have to do.
Okay. Uh,
Hmm.
okay.
Any social support, any summary
I told you we'll discuss with him under social, yeah, social and emotional
with
support.
me, with
With
the
him,
wife.
because I will arrange a meeting with
The
Mr.
wife needs
John later.
support. The wife needs support.
Okay. So um, I would refer you to social services just to give you an appropriate support. Is it all
Okay,
right? Okay.
okay.
Okay, seems the wife and the doctor satisfied with this meeting so far.
No, actually, is the scenario.
Yeah, it's a vague scenario. Yeah, really, yes, it's difficult one, and it's difficult to understand also what's ongoing. Anyway, I'm not sure also about what you should do, but let's hear from Dr. Sarah if you are done. Okay. Or you want to add anything else, Dr.
No, no,
Muhammad?
no. Just move on. Move on.
Okay, Dr. Sarah, you can start now commenting because
Okay,
need your comment because it's not clear scenarios so far. Okay, you can
okay,
start.
okay. Okay, from the start, you confirmed that she is a wife, but you have to ask if she need any support, what is her expectation about the meeting, and address her concern that there is delay because he has this pleural effusion, and this is an urgent situation because it is malignant. So there is a delay, and you should apologize. Okay, this is the first one. Second one, breaking bad news. You did it well. Okay. Okay, and because this, when there is pleural effusion, this is that mean it is terminal, and you need to talk about the palliative care and no surgical treatment, and the case is really advanced. Okay. Okay. After that, you
Could
need to talk
could
about the
sorry,
yes.
please.
Okay. Okay.
Could I assume it's terminal? It should be written.
Yes, and
Um,
below effusion, not terminal. I
no,
think
it is
that
terminal. No, it is terminal. It is.
If
I did it like you did. Okay, but it is
no,
terminal.
but if
Pleural
if
effusion is
if the
terminal.
scenario appears in the same with pleural effusion, I will not assume it's malignant. It should be mentioned that it's terminal.
Yes, let's.
Uh,
Okay, Doctor, I agree with you, Dr. Muhanna, but go back to the nature of the malignancy or the cancer. It's adenocarcinoma, and already there is spread to the pleura, and the pleura confirm the cells of
Malignant
malignancy.
cells. Yes.
So yeah, I
yes,
guess
yes.
it's
Yes.
yeah, right.
It's
Pleural.
yes.
No need
It's
even
myths.
for histopathology. Yeah, it's myths.
It's myths. Yes. Yes.
Okay,
So
go ahead, Doctor.
you need to talk about okay. You need to talk about the palliative care. Okay. After that, okay, the autonomy of the patient that he need to know, and you told her this in a good way. Yes, we will tell him gradually, and we will involve the social services with us. Okay, okay. Then asking you because it is terminal, so you need to ask about wishing a living wish and also last power of attorney, and you did it, and this is very good. Okay. Um, Okay, and you need some sympathy with the wife, and some social support and some help if you want. And no, you don't need to talk about smoking. He is terminal. Okay,
He,
that's it.
he can carry on smoking then.
Yes, enjoy if you can.
Okay.
Enjoy.
Yeah, enjoy your end of life.
You lost
Yeah,
days. Yes.
yes, exactly. Okay, thank you, Dr. Sarah.
Mm.
Uh, yeah, well done, Dr. Ahmed. By the way, you did most of the task apart from the palliative, okay? And there is also the fact in the apology. I was the same you're thinking. It's not delay, but yeah, as Dr. Sarah said, it's clear as delay because it's 2 months. And the symptoms, you said by yourself, there is weight loss along with the cough and breathlessness. Okay, let's assume the patient had breathlessness and cough only with no weight loss. Okay, that time it could be any similar pneumonia, similar condition like sarcoidosis, something which is not serious. Once the patient had weight loss significantly, we had to suspect the cancer, and the GP himself should refer the patient to the concerned team or the hospital or whatsoever to do the other investigation if he suspect. But since he didn't suspect it as a cancer while he has or while he had beta symptoms or B symptoms, it's clear that delay diagnosis or misdiagnosis, right? You agree with me in this point, Dr. Muhanna?
I think, Dr.
Yeah,
Basim, it is uncertainty because he can't judge.
why?
May GB told him made X-ray, make X-ray. Can't judge what GB done
Okay,
for the
if you are
patient.
not sure, yeah, if you are not sure about, you can tell the wife that you don't know about the details,
Yes,
and yeah, you
yes,
should or your husband should have a chat with his GP, what was ongoing. By the way, I was also saying or thinking it's not an error, but I surprised when Dr. Sarah said it's error. But when I realized the scenario, the patient lost a lot of weight, right?
He
Since
has
there
alarming
is,
symptoms, I mean. He has alarming
yes,
symptoms.
exactly. Yeah. So you have to put the cancer in your mind as a differential. Okay, he can wait for 1 week, 2 weeks, but if extended to 2 months, means there is delay, referral, and delay of the diagnosis. This is what also I realized when she said, Dr. Sarah, I mean. But for me, I will be like sorry only. I will not apologize, but I will be sorry what happened to your husband. I'm so sorry for him and about his suffering. However, the symptoms always mimic or similar to other symptoms of other diseases. Your GB did the best interest for him. However, he came to us maybe in late stage, and we when those did our investigation, we found that he had blah blah blah. This is what the way I was about to do. But Dr. Ahmed did also the same pathway or the same approach. But Dr. Sarah said no, it's clear that there is delay. And also, I guess that duration is too long to wait for patient losing weight, having loss of appetite, and also cough and breathlessness for 2 weeks without referral. I think also makes sense that it will
I
be
think
delay
I think
management and
he referred from GB. The problem is the waiting list in NHS at 8 weeks. So it's the organization is not medical error. It's not
okay.
error of GB or not error of me. It's not error of us. It's not error.
Okay, let's read it again, Dr. Mahanna. Okay, 3 months ago, dry cough, breathlessness, anorexia, weight loss. He had to wait for 8 weeks before being seen in an outpatient clinic. Okay,
Yes. So there's no delay in referral. The
I'm not
delay
Yeah, you mean he was referred and the delay of the appointment.
delay
Okay,
in okay, so this is I don't know. This is organizational or national agent.
uh,
Should I
We can
apologize on
took
behalf
it
of
like miscommunication.
maybe, yes.
Miscommunication.
Yeah, I agree. He should be urgent referral, not like regular referral or to wait for 8 weeks. It's yeah, a long time.
We don't know, sorry, we don't know what happened. So it's like the case of uncertainty. Same like we deal with, we are not sure. Like we need to investigate further to find out what exactly happened. Maybe the GB sent it as a fast way tracked referrer, but for
Okay.
some many reasons, sometimes there is like Christmas holiday now, so there could be some reason for delay. We don't know, so there is uncertainty. We will tell him we need to investigate this seriously and find out what exactly happened, but we are not sure.
Okay.
Of
So, Dr. Afak, I agree with you. Since you said I will investigate means there is something
Yeah,
defective, right?
there is defect, but sometimes the defect is in the NHS system. There is no one
Okay,
info.
still there is some mistake or miscommunication. Will you
But we,
apologize
we
or
we
no?
will apologize. Of course, I will apologize.
Yeah, so yeah, we will not blame the GP, which is also here not clear that the GP didn't delay him, but there is something wrong. Why 8 weeks waiting for an appointment? This is
Yeah,
also a
we
mistake.
need to find out. We apologize and find
Yeah,
out what exactly
yes,
happened. Yeah,
exactly.
yeah.
So again, it's a matter of some delay. Okay, if 1 week, 2 weeks, it will not be matter. But for 8 weeks, 2 months, I mean, it's long time to be seen or to be investigated once he had B symptoms. This is also my opinion. We have to have a deal that this patient had delayed diagnosis, right? Agree, Dr. Ahmed, so far?
Yeah, there's delay. The problem
But
is
from,
we
yeah,
can
from where?
admit it like an error or not. Is it an error?
Okay, the delay itself is
Is
error,
it a
right?
medical error?
The delay is
Yes,
an
the
error, and
delay.
you have to
Yes.
apologize once at least. At least once.
Apolog- okay. I
Okay,
mean, this
at
is
least, or
organizational error. So it's, I mean,
Even.
Dr. Muhanna, yes,
mm,
you said error. Organization, communication, it's at the
okay,
end is an error.
okay.
By the way, I was thinking like you, by the way, I will do what you do or what you did. But Dr. Sarah now corrected us. So this is her scenario and she already read
Okay.
about it well and she prepared it well. Okay, so let's understand what's the real thing about the scenario and how to correct our thinking. You agree so far? Okay, because I will comment or I will move to the next point. The next point
Yeah.
is you already had in the scenario that you have acceptance from the wife to talk to the husband, right? So better to assume it from the beginning. This is in the introduction, I mean, since he had, or it's written there, your wife or the wife or the husband give you approval to talk to the wife, so you can assume. Especially, there is some confidential point in the middle of the scenario, which is, don't tell my husband, right? So you have to tell her that we are here after your husband approval, and we are that the meeting after his permission. Then, if you want anyone or him to attend, you can offer, because also she will be shocked at the this news. The next point is breaking bad news. You are talking about cancer. I think you have to give her warning shot and some golden silence, giving her time to react and so on. This is also my opinion in the introduction. The point of lasting power of attorney, yes, you have to do. But as you said, any living wish for him. And if she said yes, do you think he will? Yes, tell her the truth. It's a cancer and it's advanced stage of cancer, and we are sorry and afraid to say the cancer nature may make the life shorter than the normal person. That's why we are here and we are addressing this point with you. Doctor, don't tell him, as you did exactly. It's his total right to know about the condition, and don't worry. If you are worried about something, let us know. Okay, I wished if you can ask her why you don't want him to know. Right, Dr. Sarah? You want to say
Yes,
something about that?
yes,
Yes.
I told him it will be difficult for him.
Yeah. So yes, as I appreciate your worries and your care about your husband, but no worry, we have our expert team. We can give him the information gradually, as Dr. Ahmed said, and in pieces, and they will, or they know how to give such news to the patient, and they are concerned about this, or they are specialized in this point or in this type of breaking bad news. This is regarding the don't tell my husband about the result. The next point is the social support. As Dr. Sar said, you can give a lot of support to her. And the last point, the smoking or alcohol or whatever he's doing bad in his life, let him enjoy the last moment in his life. Whatever he's doing, okay, even he will take injection, recreational drugs, but it will not be to this extent. But I mean, the concept itself is accepted. He's dying by anyway. Nothing will be offered to him. You can raise the issue of palliative therapy, including under the palliative therapy, as some doctor said before, the chemo, the radio, or any type of procedure or something to relieve his pain and to make his last days of his life comfortable. You can raise it once, okay? Instead of saying group of doctor, you can say palliative team. And you can explain who are the palliative team composed of the lung doctor, the cancer doctor, specialized nurse, which is Macmillan nurse, and social worker for support. Okay, you can do it. I mean, once only. I think this is the hidden agenda in this scenario. And by the way, palliative therapy always come like hidden. You have cancer patient and you have to talk about and to counsel about it. The hidden point will be palliative because the cancer is advanced, extended, and spread everywhere. I guess it's clear now, Dr. Ahmed. Yes. By, by the way, the scenario is difficult to understand. I didn't understand well. That's why I'm
Um,
always giving time to
I did it
digest the
like
scenario.
this. I did it like
Yes,
this, like Dr. Ahmed,
all of
exactly.
us.
And he did it
Yes.
well, really. He addressed all concerns, apart from the palliative and about the error. He didn't apologize, but everything he did it well, and I did it like this exactly. You did it well, Dr. Ahmed.
Thank you.
Okay. Thank you, Dr. Ahmed. Well done. And I appreciate Dr. Sarah effort in this scenario. She was so tough, and we have to be like this. I mean, as a surrogate. Really, in the exam, the surrogate is very tough and aggressive with us. So we have to train with such kind of aggressive persons like Dr. Sarah did. Angry wife, she doesn't want her husband to know. She's always attacking you. There is something happened. There is mistakes happened because in the exam, in real exam, you have to solve this instantly. I mean, you will not think twice. Once she will tell you something, you have to solve it immediately without thinking. If you trained on that, you will be excellent, and inshallah, you can do it in the exam. But if you are stressed here and you didn't do earlier, you will be more stressed in the exam, and uh, unfortunately, you might fail the station if you didn't stop here or calm her down. Okay. Any question from others? Yeah. Any apology? Yes, you have to apologize. You have to apologize because the duration itself is long and the cancer symptoms was there. The GP should refer this patient urgently to the hospital or to the specialty. Any advanced cancer for palliative? Yeah, this question good. Yes, any advanced cancer with spread or metastasis for palliative until proof otherwise. Okay. I mean, for example, Hodgkin lymphoma, one of the exceptions of the cancers that it will respond to the chemotherapy. And this scenario is known in the PACES, all PACES. Hodgkin lymphoma, one of the best prognosis cancer in PACES and in reality, by the way. The patient will respond to chemotherapy, how many sessions, and he will be free of everything. Apart from the recurrence, which is expected, but it's not like others. Okay, this is the only exception in PACES. There is a lot of cancers I'm not aware about in the real life, but in PACES, Hodgkin, one of the responsive and most, I mean, carrying the best prognosis in paces. Okay, if you have Hodgkin scenario, don't tell as breaking bad news. You will tell like, yeah, there is cancer, but the good thing it's responsive. We can start you on sessions, and the Hodgkin always comes with chemotherapy as a task. We will insert Hickman line, and he will receive multiple sessions for chemotherapy. He will be improved, and he will be fine, and he will be near normal life in the future. Okay, thank you. To any other question? Whatever the defect in either the
I don't know, just from my
miscommunication.
knowledge, palliative care, sorry, Dr. Basim.
Yes,
Palliative
sure.
care, we don't speak about it. We don't speak about palliative care unless it's mentioned in the scenario. So in this case, just we will say we refer you to group of specialists, including cancer doctor, Macmillan nurse. But we're not going to speak about palliative care because palliative care in the UK means only symptomatic treatments, doesn't involve chemotherapy or radiotherapy. We don't know what's gonna, even if the patient has metastasis, still they can give them chemotherapy, radiotherapy. It's the oncology team's decision. So just in this case, I would only say I would refer you to group of specialists to give you the proper care of management without specifying anything. So I wouldn't speak about palliative care because if I said palliative care, it means symptomatic like pain relief, anti-sickness medications, and it means end of life pathway, which is not written in the case.
Okay, logical. What do you think about this patient's expectancy, life expectancy?
Even if
It-
it's 1 day, if it's not written, I wouldn't speak about it.
Okay, what
I
I
know
understood in
very short
basis.
life, his metastasis, and but maybe basis in the بالدول
Okay,
العربية different,
no,
but from my knowledge, because I teach clinical communication skills in the for Pillar 2 and for in the
okay,
university, so I know the rules very well here, so it doesn't apply here, but maybe basis worldwide there is different rules. I'm not sure.
okay. So let's say, I mean, and basis wise, also I faced in a lot of scenarios in basis, whenever the patient having cancer such type and advanced with metastasis, they will write for you palliative as a task. Okay, believe me, it will be in the task. But if not written, either you will raise it once, or as you said, you can do a group of doctors, including the cancer doctor and the lung doctor. But I believe it will need to be raised, the issue of palliative
But
therapy.
it's not junior doctor decisions. Even if the patient dying right now after 5 minutes, I can't. I work here. Yeah, I can't make this decision. It's a consultant decision. If it's not written, this patient for palliative care, I can't make this decision. I can't speak about it. This is the rule.
Okay,
Okay, doctor. Just a minute, Dr. Basim. Okay.
yeah, sure.
This case written in the MRCB UK book, and I can give you the soft copy of this, and it is written to talk about the palliative care and no active cure and talk about this. Was not written in the scenario, but in the judgment it was written. I agree with you. والله يعني we all think it is not our decision to talk about this, but
Yeah.
they talk in the analysis of the case. Okay, you need to talk about this, the palliation or the palliative care.
So
Okay.
always the conflict in such kind of scenario. Always, whenever we did this scenario in any session, always there is conflict
Mm.
about this point. Anyway, this conflict make the things clear.
Maybe
Let's
just without mentioning the word palliative, I would say like I would refer him to a group of doctors, including cancer, blah blah blah. I would also say, believe, make sure we're going to make your husband pain free and give
Yes,
him
this is
all
the
the
point. This
symptomatic
is
treatment. So
exactly.
indirectly talking about palliative care without mentioning the word palliative care. If that helps.
Yeah. Okay. What the palliative care for?
Palliative
You
care
give
is just
me.
for symptomatic treatment.
So, and what you are saying in the management plan about the team or the group of doctor, what they will do?
They can give chemotherapy, still radiotherapy, even if the patient has metastatic cancer.
Perfect. Do you
Yeah.
think the palliative, not including chemotherapy or radiotherapy, sometimes and some cancers, including palliative chemo and palliative radio, right? They are sometimes doing that, but they are talking about the life expectancy for the cancer itself. Is it long or is it short? Again, it will be palliative. They want to be sure the patient will not suffer in the coming days or months or years. The palliative will not interfere with antibiotics, it will not interfere with the medication, the feeding. If you are talking about end of life, it will be different because end of life they will withdraw everything. But palliative, they can give everything, they provide everything. This is also the concept of palliative, along with your group of doctor. Yeah, they will maybe
Okay.
decide, and mostly they will decide for palliative. But anyway, in the paces, they will write for you the task clear. I'm sure about that. Clear. Palliative. So you'll talk about palliative. They want you to speak about palliative, and they want to judge you on the palliative points or component, how you can judge or how you can do it in this. So they will write it clear, and they will judge on you how you perform it. No worry about that. But the conflict always make the things
Okay.
clear. Always I'm saying that. You got
Good,
it,
good.
Dr. Afan.
Yeah, thank you. Yeah. Thank you so much.
Yeah, most welcome. Most welcome. And thank you also for your comment and the clearing the points or clarifying the debate about this point. Okay. Any other comment from others before moving to the next scenario? I don't know. Dr. Muhanna has a scenario for Dr. Sarah.
I
You
have good
can
scenario,
prepare
Dr.
us.
Bess. I have good
Oh,
scenario.
No, I don't have any scenario. I
Okay,
just
I have good
okay.
scenario.
Okay, Dr. Musa will be surrogate instead of Dr. Muhanna, his friend. Okay.
Okay,
So you will be the surrogate, Dr. Musa.
it is
Should
a
I
good
accept
scenario.
it? Should I accept this?
It is a good scenario and a new scenario.
Okay, what
Okay,
you think, Dr. Sarah? You want to practice or you want to stop here?
I will try. I will try.
No worry,
No,
Dr.
no,
Musa's
no.
scenarios
It
are
is
very nice,
yes,
like
yes,
him.
very,
Yes,
very
I
nice.
know. I know.
Okay,
That is a scenario.
again, Mr. Sami, the victim of Dr. Musa. Mr. Sami, 40 years, has rheumatic arthritis, not responding to DMARS, disease-modifying agent for rheumatoid arthritis. Okay, now for biological investigation, shows
Now,
latent.
now for biological investigation
Okay.
shows.
Now for biological investigation shows latent TB. Please discuss with Mr. Sami his investigation and plan of treatment. Nice scenario.
Very nice scenario.
Yeah, you should learn all types of scenario, Dr. I will give you 2 minutes, and then you can start.
Okay.
Okay, ready, Dr. Sarah?
Here.
Yes, here
Let's
you go.
try. Okay. Hello, I'm Dr. Ghanem, Dr. Inclek. Today, may I confirm you are Mr. Sami, 40 years old?
Yes, doctor.
Okay, hello, Mr. Sami. We are here to discuss issues related to your health condition. Is it okay with you?
Sure, doctor. Sure.
Okay. During our conversation, if you want to ask me any question, please don't hesitate, okay?
Thanks, doctor.
Okay, could you please tell me what is the problem?
Yes, doctor. I have been complaining from severe joint pain. I have rheumatoid arthritis. So I tried many medication, but not respond. I still have joint pain. Your consultant told me that he will try another module of treatment. He made some investigation, and now I am waiting for this investigation. Could you tell me?
Okay, Mr. Sami. Yes, I know you have this rheumatoid arthritis, and you started the medication for this. And now we need to escalate the medication to the higher level because your symptoms are not controlled.
Yes,
So
doctor, I know.
yes, what we need to do is to start some treatment. It is called biological treatment. Do you know about it?
Yes, doctor, your consultant told me about this treatment. He told me that he will help me about my joint pain. Please, doctor, give me
Okay.
this medication. I have severe joint pain.
Okay. Okay, this medication can really control your symptoms, but before we give this medication to you, we need to start some blood test to confirm the state of your defense system and your health. And we found that you have a condition. It is called latent TB. Do you know about it?
Oh, doctor, I don't know. Is it serious?
Okay, this condition it is not serious for your health now, but when you take this biological medication, this can cause like flaring up or increasing the infection. That means you have the infection of tuberculosis. Do you know this infection, this type of infection?
Yes, doctor, I know tuberculosis. My mother has have tuberculosis.
Oh, I'm sorry for your mother. Okay, this
Thank
disease
you.
can affect your lung and maybe other organs in your body. And maybe you take this infection from your mother, but it is not obvious in its symptoms on you. It is like latent or dormant or not active. But when you take this biological medication, this causes activation of this condition and starting to have the symptoms of TB, just like your mother, like sort of breath, like coughing up blood. All these symptoms, and they may also can cause worsening symptoms, may affect your breathing at all. Okay, are you with me?
Yes, doctor, with you, but my mother, I know my mother have cough and also have fever, but I am okay. I have no any symptoms. I have no
Yes,
cough, no
yes.
fever.
Okay,
What is the difference?
yes, this is the meaning of latent. Latent mean dormant or not active. I mean, the infection or this superbug present in your tissue, but not like breeding or not increasing in size. Okay, are you with me?
I don't understand, doctor.
Okay.
Please.
Okay,
I,
so this infection, it's a very severe infection. It can present in our body for a long time, and without any activation. Could be just dormant or sleeping. You can see or not active. And with sometimes some infection, some drugs like this biological medication can become activated and start to make like a spot of infection and start to spread from this.
okay, doctor. All my concern is to start the treatment, start the medication of my joint pain. That's all my concern. I didn't
Yes, I
concern. I
understand.
didn't. Mm.
I understand your concern, and it is valid. Um, okay, because of your condition now, that is this latent TB or this infection that is not active, there's a big chance to start it. So what we need to do now is to arrange a team of doctor, including the lung doctor and the special nurse, social and occupational workers, to start like giving you some medication may try to kill these bacteria and start your biological treatment as soon as possible. Okay? Is it okay with you?
Okay, doctor. Okay, thank you. So when
Okay.
I will start, I will start my treatment. Sorry, when I will start my treatment, biological
We will
treatment.
arrange. Okay, we will arrange this team of doctor as soon as possible to start your proper management plan for this latent TB first, and then after that to start the biological treatment. Meanwhile, we will give you some medication to help you decreasing the pain and decreasing the inflammation in your body till we start this biological treatment after treatment of the latent TB. Okay?
Okay, doctor. Thank you very much. Thank you. But for how
Okay.
long I have take this medication?
Okay, this is decided by the team. Okay, and according to your response to the treatment.
Okay, doctor. Okay.
Okay.
Thank you. Thank
Okay.
you very much.
Okay. So, can I ask you some questions?
Sure, doctor.
Okay. What do you do for living?
I'm a nurse.
Okay. 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 We will involve the occupational services that can help in this regard because of this infection. They can help with this. Okay. Okay. Do you smoke?
No, doctor.
Okay. Do you drink alcohol?
No, never.
Okay. Okay. So you have any other concern?
Yes, doctor. I will stop I will banned from my job.
No, no, you will not be banned from job.
Still working. I will still
Um,
work.
for now, the treating team can help with this and can tell you what we are going to do. Okay.
Okay, doctor. So what I will have to do now?
For now, the treating team can do the can arrange a meeting with you with our consultant and also the team. They can formulate the proper management plan.
Okay, doctor.
Okay.
Thank you very much.
Okay, so from what we talk about, we decided not that we will start treating this latent TB first before starting the biological treatment according to the guidance of the treating team. Is it okay with you?
Thank you, doctor. Thank you very much. Thank you
Okay.
very much.
You have any other concern?
Yes, doctor. Can I go home?
Yes, you can go home.
Okay, doctor. Thank you very much.
2 minutes left.
Thank you.
Okay, I have nothing to say.
My mother have to be in the home.
Dr. Sarah, you give suggestion to Dr. Mahanna when he had 2 minutes left. Do the same suggestion.
Yes.
I did it. I did summary.
Okay. Can I stay with my mother, doctor?
No, for now you cannot stay with your mother. She is. You told me she is treated, right?
No, doctor. She has symptoms. She has cough and
Now?
fever. Yes, doctor.
Okay. Okay. So you have to be away from her until she is treated.
Never, doctor. I give medication to my mother, to my mom. So what can I do?
You can wear protective equipment like to wear a mask and take care of washing hands when you're giving her medication. And try not to be with her in a closed place. Um, okay.
Okay, doctor. Thank you very much.
30 seconds.
Yeah.
Okay, let's assume that you already summarized, Dr. Sarah, and you
Okay.
have still 1 minute. What can you do if you summarize?
Check
I can give you brochures, the leaflets, and the
Okay.
contact number of
Yeah, this is
our
at the
hospital.
end. Yeah, if you have one
Okay.
and a half minutes, You
And
can
you have
offer,
any alarming symptoms like
yes, red
coughing
flags.
up of blood, okay,
Yeah,
any
red
fever,
flags.
any night
Excellent.
sweats, you can contact us.
Okay, and also if you have still time, you can ask her to recap what happened between you, both of you, what you have been discussed today. If you have time, of
Okay.
course. But I will comment on that after Dr. Mahmoud comment. Please go ahead,
Yes,
Dr.
Dr. Bassem, thank you, Dr. Sarah. It is
Mm.
a new case. I see this case in India. Okay, latent TB means it is sleeping tuberculosis, not latent TB. In non-jargon, it is sleeping tuberculosis. Can be reactivated when your defense system will be decreased, and can be reactivated at any time in your life. So we have to treat you treatment with some medication like isoniazid for 6 months and or two drugs for 3 months. So it is the treatment of latent TB. So the surrogate will tell you can I still working like that? Latent TB, no need for isolation, no need for stop working. It is latent TB. Um, Okay, at the first we said to the surrogate you have a sleeping tuberculosis can be activated in at any time. The investigation and the difference between active and latent TB. That latent TB has no symptoms but can be activated at any time. Even any illness, it will be activated. So it is better to treat this latent TB. We said about the medication and about his mother. His mother. Sargot tell you, "Can I go home?" So you should tell him that you can go to your mother, but it is better to wear any gloves or any gloves or masks when entering to your mother. As I told you, you have sleeping TB can be reactivated, so it is better to wear protective measurement. Also, he can still working, no problem. Even it is a nurse. The patient was nurse, so he should stop take sick leave till he will be treated. It is in the medical field. The medical field just must stop working. Okay, that's I have. Thank you, Dr. Sarah. Thank you, Dr. Basim.
Most welcome, Dr. Muhammad. Thank you so much. Very nice scenario. A challenging one. I guess Dr. Sarah did this scenario before. She knows how to address, and she started well. And I guess you were so fast, you want to finish everything. That's why you have 4 minutes at the end. Okay, I guess so. So you delivered the news, you did everything in the proper way initially, but at the end, you had a lot of time and you didn't address the welfare for this patient, which is very important. 2 points very important in this scenario in the welfare related to the patient and the mother. Okay, let's start from the mother. When he asked you or when he said to you, "My mother was sick," you just said for him, "I'm so sorry about your mother." Okay, then?
I thought she was sick. I didn't
Yeah, yeah.
realize she is
Okay.
sick now.
Yeah, it's okay, Dr. Sarah. I'm just asking you what you should do. Okay, if I repeat the scenario again to you, and I'm always giving this advice. Someone told you about his father, his mother, what
And
you should
how
do.
is she doing now?
Exactly. At least one time about her condition. How is she now? How she's feeling now? Is she's fine? If she's fine, that's good. If she's sick, I'm so sorry for that. If she is dead, I'm more sorry and my condolences to you and your family. But just act like you are acting in the exam, okay? Giving a lot of sympathy and empathy. Once he explored to you, "My mother is sick," you have to act about that. How? How is she now? And he will tell you, "Yes, she is sick." And he gave you again tears saying, "She is sick and coughing and she has a lot of symptoms." So what you will do now if you repeat the scenario and he told you, "She's sick, doctor, she's coughing," and what you should do for her?
Did she Seek medical advice. She taking medication.
Exactly. You have to address it. If it is related to his condition, you have to address it. If in direct relation to his condition, also you have to address it. In this patient, she has direct impact on his condition. He already had the infection from here, and if he got the biological therapy while she is still untreated, he will have the active TB again and again. So how you address that? By treating the mother herself. You can offer that. Please, if your mother not feeling well, you can bring her to our hospital. You can refer her to the GP, or if she's fine taking her medication compliant way, she can stay at home away from you. Why? Because also you had an infection and a possibility to have the infection from here. And we are trying now to control your TB, which is already in sleeping mode. You got it? So if you touch this point once, it will be good in your mark about the welfare. Please, if you need or your mother need any help, let us know. At least offer help. If not, do the best thing, which is refer the mother or stay away from the mother. Don't be near to her, and distance, good distance, and these things, because he will get again the infection as long as she has open TB. Okay, you can give her some advice about that. To be compliant for 2 weeks. If she's fine, the infection might be okay. And regarding the TB, it's superbug. You said the bacteria. You have to say superbug about the jargon I'm talking.
Mm.
Okay, this is another point you have to do. Regarding her job or his job, he is a nurse, right? If he
Yes.
address this point clearly to you, doctor, will I continue my job? What do you think? If this patient working, for example, in the ICU, you will let him continue working in the ICU? What do you think?
It's
Indirect,
latent. It's latent. I think.
yes, but he's
Why
going
not?
to take. Why? But he's going to
He will
take.
not. He will not going to take until he take medication.
Okay,
So
when
he
he will.
need to be reallocated.
Exactly, this is the point. So you can tell him, as Dr. Mahmoud said, you can give him sick leave, but I think sick leave will be very long. He will take monoclonal for a long time. So the best way to refer him to occupational worker, if he insists to work, they can reallocate you in a job, in the office job, or in away from patient contact. For example, in the radiology department, he can help in another department which is in not in direct contact with a patient. Okay, S- any contact with a patient, for example, having chest symptoms, he might have the TB again, or he might have any other infection. He will be immunocompromised. He should be away from this kind of jobs. So he can offer office job, right? Most of the nurses, or there is nurse, I will not say most, but there is nurses working as quality nurse. They are not in contact with the patient at all, just paperwork. He can be allocated there until he will be fine from the infection risk, and he will be also away from the monoclonal, or he will be finished the course of monoclonal. This is good suggestion to do it. The last thing, the smoking. Did you ask? I think you asked, right? The ask.
Yes. Yes.
Yes.
Yeah, the smoking, the alcohol, the job, and the point of mother. Yes, please stay away from here as long as she is coughing and has symptoms. Okay, if his mother taking medication and she's free of symptoms, is he allowed to be in direct contact with her, Dr.
Mm.
Sarah?
No, I don't know.
He can, but in good distance, as you said, wearing some precaution.
Not in a
As
closed room, maybe.
yes, exactly. As long as his mother is free, so she's not coughing, the TB is already managed or treated, the course of anti-TB completed. Yes, he can be. But as long as his mother coughing and she's already in active state of TB, he will get again the infection, and you just try to finish or to kill the latent TB. He will again be infected from here, or he will contract the infection from here again. So what the benefit of that? You got this point,
Yes.
okay?
Yes.
I think the other thing you covered it well. I think you did this scenario before, right?
Yes.
Yeah. So you know how to speak about TB, the explanation, but please, in order to be in the conversation way, give sentence and ask him. Don't give him or don't rush giving him a lot of information. He will tell you, doctor, what you are saying. And if the
Okay.
surrogate told you what you mean or what you said, believe me, they will minus you in the communication skill. One by one or
Okay.
sentence by sentence, then you can tell him, are you following me? Do you have any comment? You have any concern so far? And so on. Okay, any question, Dr. Sarah, Dr. Muhammad? Yes.
Yes, doctor. It is was another concern. When will I will start my biological treatment? So we will tell
Yeah,
him.
good point.
Yes,
Yeah.
so we will tell him we now at the
Meanwhile,
meanwhile we will treat this latent TB, and then you will assess again.
exactly.
Yes,
Yes.
you will assess again, and according to the assessment, you will give you the biological treatment.
Okay, knowledge-wise, Dr. Mahmoud, clinical judgment, they might ask you a duration.
Yes,
What's the least duration for anti-TB, for latent TB, that can clear the infection? What do you think? Or Dr. Sarah? I think you know the information. This,
yes, 3 months to drug, 1 month, 6 months, one drug.
2 months for
yes,
INH. Yes.
yeah. So it's
But
like the,
we can say it is about your response.
yes, exactly.
Like
So don't be sharp in the answer. It's 3 months. No, sometime they are checking again. If the patient clear of infection, they can start the monoclonal therapy or biological therapy overlapping with anti-TB. This was a suggestion before about the anti-TB along with the monoclonal. Okay. So again, as you said, Dr. Mahmoud and Dr. Sarah, you will be assessed again of the infection state, the bug state, and your defense system state. Accordingly, they will decide when to start this monoclonal or the biological therapy. Clear?
yes.
Yes. So this, as a clinical judgment, always be diplomatic in such questions. Don't give sharp answer about duration or uh, time or onset. Be diplomatic always. You will be assessed again. If she insists to know, you can say couple of months and we will assess you again, or couples of weeks. Don't give sharp cut for the duration. 3 months, and how do you know it will be 3 months? He might respond well after 1 month, and he might start. And it's not your decision by any way. It's pulmonology or just chest doctor along with infectious disease team. If you are not sure, you can say, yeah, it's a decision of our group of doctor expert, and they can give you the medication according to your response and your defense system. Okay?
Okay.
Clear, Dr. Sarah?
Yes.
Dr. Mahmoud?
Sure, Dr. Basim. Sure. Thank you.
Okay, doctor. Thank you too. Dr. Mahanna, any comments?
Yes, if the latent TB is not infectious, so why should you keep him away from his mother?
He's the one will be infected.
Okay, so because she's sick. So,
Yes.
but there is no isolation for latent TB.
No, the isolation for his mother.
Okay, and is it treatable? So should treat it or not?
The latent?
Must be treated, Dr. Ahmed.
Please. Okay.
Yeah, this is the concept of the scenario. He should be treated because once he will receive the biological therapy, it will be reactivated and it will be active bug. It might be manifested with symptoms.
Okay, and what is the treatment regime?
Yeah, as Dr. Mahmoud said, there is either double medication or dual medication, anti-TB, for 3 months or single for 6 months. Isoniazid, rifampicin. Either both 3 months or one of them for 6 months. Clear?
Okay. Then how can I follow up? How can I confirm it's treated? Quantiferon test?
Yes.
Quantiferon,
Yeah,
yes.
quantiferon tests, yes.
Okay. Thank you.
Okay. Thank you too. Also, Dr. Sarah, if you have time, as you said, anyone in the exam has time to do something, he can give red flags about the condition itself. Whatever, counsel about medication, give red flags about the side effects. For example, in this scenario, you can give red flags about the side effect of anti-TB, redness in the urine or redness in the saliva or the tears, or sometimes you feel tummy discomfort.
Soreness of the nerve cable.
Yes,
Yes,
soreness.
numbness of the
Yes,
hands.
yes, numbness. Anytime you have any scenario, you have time to do something which is missing or you didn't do, or you have available time, you can address, put in your paper down red flags. Red flags is very important. It can give you full mark in any scenario. Okay, red flags mean you are caring for the patient. You are giving him follow up. Something might happen in the future, and if he knows about it, you might protect him from something serious might happen. Okay, like in this scenario, if he had numbness and he doesn't know about the numbness and tingling, you didn't tell him about pins and needles. Okay, he might think this is something related to trauma, or he might continue the medication without, and he will be symptomatic vitamin deficiency, right? Sometimes, if maybe not treated, it will be irreversible or whatever. What I mean, don't let him go if you have time, of course. But if the discussion was long and you don't have time, so do your task. And the social, smoking, occupational, the job, driving sometimes. But if you have time and you both of you are silent, surrogate and you, either summarize or put a red flag, alarming sign, warning signs. You can give this as safety netting. They are saying this is safety netting. If not, it's okay. At least do your task. Clear? But please write it in the paper outside the scenario. Put a circle and write red flag. Red flag, the examiner like this thing. Red flag, follow up, post-operative care, post appointment. These things make you full mark in the welfare and sometimes also for the concern. If you give him a follow-up appointment, if you promise him that we will never forget you, will never leave you alone, they will respect this thing.
Okay.
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 Well, okay. Thank you, Dr. Sarah. Any questions? Let's read the comments quickly. Anyone has comment, please. He can talk. Dr. Afak here. Yeah, she can talk also if he has or she has any comment, please, Dr.
Yes,
Afak.
I was thinking about the palliative care issue in case, as you said, like most likely they will mention it in the task to make our life easy. But in case if they didn't mention it in any advanced patients, like metastatic patients,
Okay.
I was thinking just to tell the patient after referring him to group of doctors, we'll tell him we will also refer you to the palliative care team after discussing with my consultant to give you all the symptomatic care and make you pain-free.
Okay. So you
So
make
like
it.
just I'm telling just like I'm going to, it's not my
Yeah.
decision, I have to speak to the consultant.
Yeah, good way. You mean it's like diplomatic in between group of
Yeah.
doctor and yeah, it might be palliative, so you can
And I
take
just
the
mention it, yeah, because it's also good to mention palliative care in this station. I totally agree, but because it's consultant decision, just I will say like,
yes. Okay, I agree for this one. It's yeah, a good way to be in between neutral. The group of doctor and accordingly they might refer you to the palliative doctors or the palliative team, and be sure the palliative team are concerned about your comfortable state in
no, I
the
can still
yes.
speak about all the what palliative care involved. Maybe they want to give
Yes,
me tick for
yeah,
everything.
yeah.
I don't mind. Like I speak like after discussing with my consultant, we refer you to palliative team cares to give you pain free, and if you develop any
Mhm.
sickness, for example, nutritional support, anything like this, I will speak. No
Yeah,
problem.
agree. Okay. Well done, Dr. Afak. Good idea. Thank you. Any comment regarding this scenario, Dr. Afak?
Yeah, I think just I felt that the patient like wasn't clear enough about the descriptions of the like latent TB. So I think there is 2 points here to address, like to speak about why we prescribe in the biological treatment, because you have problem in your defense system mistakenly attacking your own tissue. So now we need to drop your immune system or your defense system down. And at the same time, you have this inactive tuberculosis because your immune system was strong enough and this bacteria or bugs was inactive. So by giving you these treatments, we will drop your defense systems and now you will develop symptoms. So I mean, like, we need to explain to the patients why we're giving
Yes.
treatment, dropping his immunity, and why he has so just to make the 2 point clear, maybe.
Yeah, to explain the things more clear, right? I agree.
Yeah.
Yeah, and there might be a comment about Dr. Sarah introduction. She asked him, "What do you know about your condition?" And he told you, Dr. Sarah. Okay, he told you, I have TB and sorry, I have rheumatoid arthritis, and they refer me to start some medication. Then when he stop, you can ask him about expectation. Okay, and he will tell you, for example, any expectation. I expect that you will give me this medication. I read about it. It's something magic. It might relieve my symptoms and so on. Whenever he stop, I always say this advice. Whenever he stop at a point, don't repeat what he said, because as you saw by yourself, when you told him, yes, you have one, two, three, and we gonna start medication, he told you, yes, doctor, I know about this. That's why I don't want the surrogate to tell you, yes, I know about this, because he already mentioned to you, right, Dr. Sarah? It's clear.
Yes.
Yeah, what I want from you to start from the point he stopped in, and you can prescribe the medication, counsel about the medication, give him the result. But don't say, yeah, because you have rheumatoid. He told you, of course, he will say, yeah, doctor, I know about this. And it will appear to the examiner that, like, I'm practiced, or some examiner thinking like that. You are not practiced well. Okay.
Okay.
Okay. There's comments. When
Yeah,
and
actually,
when,
supporting your point, like normally when we like contact any relatives, when we ask how much do you know about your father's conditions, we continue like this just to filling the gap. So like,
yes,
tell me, I will tell you just you don't know the thing that you don't know. I will not repeat the thing you know.
yes, exactly. Yeah, so you can fill what he miss or what he is not understanding, or you can go ahead to your task. So he's expecting from you to stay him to tell him something new for him, not something already he knows about. Okay, thank you, Dr. Afak.
Okay.
Yeah, thank you, Dr. Sarah, as well. Okay, the other comments. Anyone has comment, please. He can stop me and comment directly without permission. I mean, I'm reading the comment. If anyone has a comment, he can say it. When isolate, yes, I wrote this. Notify, yes, it's important to notify, I think, the mother, not the daughter or the son, because TB is still notifiable disease. So that's why I asked Dr. Sarah to ask more about the mother. Did she ask, or did she seek medical advice? Did she receive the medication by medical advice? You have to address this issue. Why she's still coughing? Something weird. The patient will have TB for a long time, not responding, or not taking medication well. Why is she still coughing? After 2 weeks, the patient should stop coughing. Okay, TB, by the way, one of the treatable and controllable condition. He might live near normal life whenever he finish the course of antibiotic. Okay, especially those without resistance, drug resistance. But when the bug or the organism being resistant, it will take longer time. When it's meningitis or something in the bone or TB meningitis or Bots disease, the medication or the duration will be longer, as we know. It might be for 1 year. But for the lung, pulmonary, I mean, it might be for 6 months. And after that, totally, she might be okay. But for the isolation, only 2 weeks is enough, especially if the patient taking the medication on time, compliant way. But okay, why should the patient stop work as latent TB is not infection? Yes, I agree with Dr. Nada. He shouldn't stop work. He can work away from patients in order to be away from any infection, I mean. But to stop him for, he will stop work for a long time. But instead, you can give him some paperwork or some office work, computer work. Okay, any job can continue working, but patient work in ICU nurse. Any job can continue working. Yeah, if in the ICU, yes, he should be away from patients, especially those in ICU, they are critical. So better to be away from them. But even in the emergency, sometimes patient coming to you in the emergency coughing, and you don't know what's ongoing with him. He might have infection or very serious. When can start biological treatment? Yes, as Dr. Mahmoud said, to be assessed. Sometimes it take months or 2 months. If he's clear, he can start. Did we raise concern about concomitant HIV infection if there is time enough? Yeah, good question, Dr. Mahmoud. But latent TB in any health worker is high possibility, right? Any patient working in the medical field might have latent TB, especially those who's working in the respiratory department, either chest or ICU or emergency. Agree?
No, Dr. Bassem, Dr. Ahmed asked about HIV. Shall we
Yes.
ask him about HIV?
Yes, I mean
Risk.
latent TB. It latent TB might be without HIV. It's not like open TB. Open TB will be associated with HIV. But latent TB and most of us as healthcare provider
Yes.
agree.
But yes, agree. But we will ask him about do you have any blood transfusion, sharing needle,
No, no,
casual
no, no,
relationship?
no. This is history taking.
Yes, that is a problem. Yes.
Yeah, so no need to mention it. And by the way, if he is HIV, they will screen for HIV, and they will tell
Mm,
you patient is HIV. You know, they will screen for what before starting monoclonal or HIV and hepatitis and TB, right?
yes.
So if he is positive, they will write for you patient is positive for HIV. This
Mm,
is my point. I mean, don't erase it. It's not necessary to ask about his HIV status. It's not necessary the patient will have HIV as long as he is TB or latent TB. Most of doctors or staff nurse or all medical team, they have latent TB.
yes.
Yeah, because they have contact with unknown TB patient. I mean, in the
Mm,
beginning. But our defense system is strong enough to stop this TB. When it will be activated, whenever this doctor or this person has immunosuppression or la samah Allah, something serious, I mean,
mm.
right?
Yes, yes, Dr. Bassem.
So it's not necessary. If TB opened or open TB, you have to raise the HIV because, as you said before, they are together concomitant. The HIV and open TB, not latent TB.
Mm,
By the way, HIV patient, if he has HIV, the latent TB will be open TB, right? He will not be in latent TB state because he has
low
immunosuppression.
defense system, low defense system.
Yes, low defense
Yes.
systems. So it will never be latent.
Yes, Dr. Bassem. Yes.
Okay. Thank you, Dr. Mahmoud. You saved Dr. Mahanna life today when you provide the case. But
My
it's
friend,
okay.
doctor. My
Yes,
friend.
I know.
My brother, Lazar. It's a must
Okay.
to stand with
Did he
him.
leave? Did he leave, Dr. Mahanna?
No.
Yeah, I think he left. Okay. Any other comments? No, he's still here. Okay, any other comments? Please feel free to comment.
Yes. The next step, next case.
Next case? No, it's enough. It's 12:30 now. And also, no one prepared the case. Suppose Dr. Abdul Menaim, but he didn't attend. Dr. Hind, I saw your unmute, but maybe you withdraw. Why? Any comments? It's our pleasure to hear your comment, Dr. Hind. You have any comment for our cases today? Okay, maybe she's busy. So the critical time for Dr. Musa.
Really worst moment in the meeting, Dr. Bass.
Yeah, okay. It's okay. Tomorrow we'll have another clinical day. I can't open my mouth. It's okay, Dr. Hind. No, it's okay. Appreciate it, Dr. Hind. We just want to hear your voice today. Any comment? But you're always welcome to comment. No problem, Dr. Hind. See you tomorrow, inshallah. Okay, we can end this session. If no more questions, see you tomorrow, inshallah, with clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام.
Thank you, Dr. Afak.